United States healthcare system, part 2, with where I left off. Technology has allowed for the use of mobile services, including blood donations, vaccination services, diabetic screening, and heart screening. From March 2008 to April 2009, a mobile primary healthcare service was utilized in Turkey for migrant workers who had no access to healthcare. This MPHS was used to treat men, women, and children, providing vaccinations, phenylketonuria screening, I don't know how to pronounce that, treatment of anemia and parasitic infections, and education on the safer use of pesticides, iodine salt, and sanitary toilet facilities. With better technology comes the computer disease registries, which offers the ability to effectively identify and manage patients with a particular condition across a region and allows for providers to identify patients as having a particular condition based on tests performed by other clinics that otherwise would be inaccessible. According to one article, the use of disease registries provides a foundation to do meaningful, population-based outcome analytics while giving clinical teams the information they need in order to eliminate gaps in care, being able to keep patients engaged with their provider in order to achieve the best possible outcomes for his or her health conditions. U.S. healthcare versus the Netherlands. With the passing of the Affordable Care Act, the U.S. has gone from a single-payer system to more of a universal healthcare system, although it's not fully implemented as of yet. The U.S. has programs such as Medicare and Medicaid. However, up until the passing of the ACA, not everyone was forced to purchase health care, and now, like many universal healthcare systems, individuals must now go on state medical, if having low income, or purchasing private insurance companies. The Netherlands has universal health care. Funding for healthcare in the United States is done through taxes on working individuals, which is the same with the Netherlands. Up until 2006, the Netherlands universal healthcare system was a government-run, government-funded system. However, in 2006, the Netherlands introduced a comprehensive reform package, which changed it from being a government-run program to an insurance-run market, meaning the government does regulate and monitor the quality of care, but it no longer manages the bulk of the funds, controls volumes, prices, or productive capacity, but rather it is funded through an insurance market whose goal is to be patient-focused and competitive. I'm sorry, I'm having a hard time reading. While government funds part of the bulk of the While government funds part of the bulk of the cost, everyone is responsible for paying for his or her own insurance or risk facing a fine of 130% of the cost of the premium, with the exception to those who fall below a certain income level. This is true within the U.S. healthcare system today as well. Although we might not pay 130% penalty, we still have a high penalty to pay. Like the U.S., both working individuals and employers must pay a tax which comes directly out of his or her paycheck. However, in the Netherlands, all individuals 18 and older must also pay a nominal premium, which is then paid directly to the insurers, which American citizens do not have to do as of yet. While the United States has better and more advanced medical technology than any other country, the U.S. also is the most expensive when it comes to healthcare cost. For example, according to one report, the cost of cataract surgery in the U.S. is $3,841, while in the Netherlands, the cost is $1,610. And the average cost of an MRI in the Netherlands is $461, while the cost in the U.S. is $1,145. So as you can see, there's quite a difference in healthcare costs between us and other countries. The U.S. healthcare continues versus the Netherlands. Part of the Netherlands' 2006 healthcare reform was to reorganize and improve the quality and access of care in the after-hour clinics as well as emergency rooms by providing complete coverage to all residents. Despite the spending on newer technology and more advanced care research is showing that the quality of care in the U.S. is no better than that of other countries, as the U.S. survival rates for a kidney or liver transplant are fairly low and mortality from asthma has increased. This is according to an article in the Nation's Health. So what they're saying is that with as much as we spend on healthcare, Americans are not any healthier. Access to healthcare in the Netherlands has been guaranteed by the social health insurance legislation, but that does not mean that one can see the doctor of his or her choosing or have a medical procedure done that maybe the individual and his or her doctor may feel would be beneficial, as the social health insurance legislation may determine it unnecessary. This type of decision making is common within the government run healthcare system. For example, a physician may prescribe a child a certain type of medication, such as a specific type of inhaler, but the state run medical provider or insurer will not pay for that particular one. When it comes to coverage beyond basic medical, both the US and the Netherlands healthcare systems pay for all medical and dental care for those under the age of 18. They pay for prenatal care, midwives, short-term care, and dentistry for those with medical necessities. Reforms and improvements. Many would like to see a reform in the disability with the main goal of having those with disabilities work longer rather than leave the workforce. Some of the ways that this could be done is by moving to a partial disability system, to which a predetermined schedule to calculate a percent disabled rating for each individual. Those percentages then determine the amount of the payments a person will receive, and by encouraging employers to continue supporting and hiring those with disabilities. More and more consumers are taking control of his or her own health care through better nutrition, exercise, and supplements. Many individuals look for help through WebMD, the Mayo Clinic, telemedicine, and other online sources to help with certain illnesses. For example, determining when a cold is just a cold and when it may be more, or when the flu is just the flu, or when it could be something more serious. The use of internet for medical questions and inquiries has been explained as a means to accelerate the pace of discovery, widen social networks, and sharpen the questions someone might ask when they do get to talk to a healthcare professional. Individuals are also starting to seek alternative therapies and medicine, which can save an individual money. For example, for chronic back pain, one may seek to combine essential oils and massage therapy or seek a chiropractic or acupuncturist. For example, in Spokane, Washington, an average price for a chiropractic care is $60 per visit, or for a massage therapist, it's also $60 for a visit. Whereas typically an office visit is far more than $60. Furthermore, hospitals, cancer centers, and long-term care facilities are starting to integrate alternative therapies such as massage and music therapy, which has been shown to reduce pain and stress among patients. Healthcare reform must take into consideration not only Western medicine and practices, but that of natural and alternative therapies, as they have been proven to reduce healthcare costs. Integrative medical approaches such as plant-based diets, yoga, meditation, and psychosocial support may stop or even reverse the progression of coronary heart disease, diabetes, hypertension, prostate cancer, obesity, hypercholesterolemic, and other chronic conditions. Sorry, I wasn't expecting those big words. The future of healthcare. Healthcare 5 to 10 years from now. I believe that within the next 5 to 10 years, we will no longer have a private sector, but rather we will have universal healthcare. Full blown. I am not sure that Medicaid or Medicare will even exist. I do believe that alternative medicine will incorporate more and more within the healthcare system, such as acupuncture, massage, and other therapies. However, I also believe that more and more individuals will be willing to pay out of pocket in order to see a naturopathic, herbalist, or other alternative doctor. I believe that e-health will continue to grow and spread throughout the world, offering better communication between medical professionals and help for patients. However, for e-health to be successful, there will have to be skilled medical professionals who are well educated in the technology. Some are calling for the nursing education system curriculum to be redesigned in relation to nursing informatics, recommending an increased information literacy education, interdisciplinary collaboration, and client-centered technologies. Thank you.